I'll let you unshare your screen. And then we'll bring on our last presenter. There we go. Great job. Okay. So our last presenter is Taylor Stewart, and Taylor has done her practicum with Ethan Walker, one of our faculty at the School of Public Health. And the name of Taylor's presentation is Wildfire Smoke Health and Awareness in Western Montana, Assessing Pilot Study Feasibility and Participant Behaviors to PM 2.5 Exposure. So nice transition into this presentation. So take it away, Taylor.
Thank you, Lee, for that introduction. And thank you, everyone, for sticking around too. Julia, great to see some of the research that you've been continuing with Montana Health Professionals for a Healthy Climate. So I'm just going to go ahead and jump right in. To give you kind of a high level view of the research project I was helping on in my APE, first I want to just talk about the context of wildfire smoke and health in Montana. So wildfires, we know, are a growing concern to public health as wildfire events continue to increase in size, duration, and intensity. And there's been a lot of research out there measuring the association between wildfire smoke and health, but there's less limited real-time household level studies. So Ethan presented or proposed this pilot project to assess household level studies of PM 2.5. And my APE project really aimed at what is the feasibility of these studies. And I did that by conducting a qualitative analysis. And so just to give you an overview of the pilot study itself, this was conducted last summer during wildfire season. It was an entirely remote field study of 20 participant households in Western Montana. We recruited these households through Climate Smart Missoula. There was just a flyer that we sent out in an email with the study criteria that participants be over the age of 18 years old and a non-smoking household, and that they had access to cellular signal for some of our equipment. And then the majority of participants were female, and the mean age was 48%. We're at the end of the timeline now, still working on analysis and publication, so need to extend that a bit, but that's just a brief overview. And then the methods of the study are just important to keep in mind because these are some of the things we really wanted to test the feasibility of. So first was the exposure assessment, and that was measuring indoor and outdoor PM 2.5 with these purple air sensors. They're about the size of a grapefruit, really low-cost monitors, which is great for the state of Montana, thinking about expanding our air quality monitoring network. But they were paired with a Wi-Fi hotspot that would allow them to download data every 2 minutes and really set up real-time data access. So the second part of the methods was just a health assessment with our weekly participant surveys. And those measured blood pressure as well as health symptoms and activity levels. And that was just sent out through an automated email. And we would send out reminder emails as needed for participants to fill those out. And then I wanted to just give a very quick overview of the preliminary exposure assessment results, because this is something we are including on our data dissemination and just return results for participants. So the key takeaways from this is that hourly PM 2.5 concentrations during this 2-week period in September were a lot higher than the rest of the study. Outdoor PM 2.5 levels, when they were elevated with wildfire smoke, would infiltrate into indoor spaces, and you can see the patterns pretty closely resemble each other. And Ethan did an awesome job with this analysis. I'm more of a qualitative person myself, but just wanted to highlight that. And then as far as the health assessments results, we saw that more adverse health symptoms were reported during wildfire days versus non-wildfire days, and blood pressure was also higher. So just to give an example of that, one of the health symptoms that we asked about was headache. And on wildfire days, the total days with reported symptoms was 20.9% versus 11.8% on non-wildfire days. And that's not to say that this is all causal. There's more research that's done with a lot bigger amounts of participants that go into that, but this is just preliminary results that we found. And so now I'm going to get into the brunt of my project, which is this qualitative analysis that I did as just end of study interviews. So we submitted an IRB amendment to conduct end of study interviews to really gauge participants' perspectives and better understand what went well in the study and what could be improved in future iterations of the study. And after recontacting those 20 participants that we had, 14 got back to me and agreed that, sure, they'd like to be a part of the interviews. So I conducted those, asking 4 different questions. And then after those were all done, I went ahead and did an in vivo analysis that I'm not going to talk too much about, but found 18 themes and 1 subtheme that emerged in the data. And so the first question asked was just overall what went well in your experience. And there were 5 themes that came about from this question. One of the first is just the benefits of real-time data. And so I put a picture here on the right to show from the participants' perspective what they could see based off the data links that they got from their own home. And they could check the air quality of the inside of their house or outside of their house in real time. And so even though this wasn't any sort of intervention study, we were more so testing the methods of the study. It was interesting to hear about how participants were using that information without really being prompted or educated. The other things talked about were just communication with study staff was nice. I think especially getting reminders for surveys. And surprisingly too, that participants gained knowledge and felt like they were had a sense of being a part of something greater. Some key quotes I just wanted to pull from those interview transcripts were that one participant said, "I appreciated having access to my own data, especially when hearing about wildfires in the news." And then also going back to communication, that it was good to have reminders and I felt supported with equipment, which when you're conducting a remote study such as this, it's really nice to know that even though we're not physically in the homes helping with things, that participants still felt supported. And then moving on to what could be improved, there were 3 themes that we saw from the interviews. The first was weekly health surveys, but also then incentive options and equipment. And the weekly health surveys were the things that were talked about the most. Things that were being measured in these surveys included physical activity, amount of time in the home, like if there was any cleaning or cooking being done. And participants just explained that it would be a little bit more helpful to know about the purpose of parameters in order to accurately answer these questions, but also had great suggestions, just including that if they had a daily activity diary, maybe they could write down these activities throughout the day. And so it would be easier to report on those things when the weekly survey came around, which just goes to show how important it is to engage these populations in research. They have awesome suggestions that can be used. And then I don't have time to go into all the questions, but I did also want to highlight how did your behavior change as a result of having access to your own air quality data. Just like I said, we didn't design this as an intervention, but in my interactions with participants, I started to notice just some movement happening with how people would conduct maybe their own little science experiments in the home or seem to be really interested in this. And so some things we noticed based on the interviews were just opening, closing windows, staying indoors when it was smoky, running an air purifier if someone had it. And then some people too that said they did not access or understand the data, which I think is important to pull out. And so some really powerful quotes from the interviews. Before, I didn't think about how quickly air from outside could infiltrate the house. I made sure the windows were closed and the HEPA was running when I noticed that outdoor PM spiked. Which goes to show a lot of participants too were becoming more aware of indoor air pollution sources and also infiltration throughout the study. And then if people have information access, they can make better decisions. I thought that was powerful and wanted to just represent that as well. And so there were some participants throughout the interview that seemed a little bit puzzled when I was talking about their own air quality data, and we did see that come out. Some people weren't aware of the data links, and so I sent those afterwards. Or mostly they weren't that concerned because, to be honest, it was not a very bad wildfire season this season, which was great in many aspects personally, maybe not as good for our data purposes. Then finally, just to go back to what is the feasibility of novel studies like this, we did an equipment evaluation, which was just really quickly rating the stages of the equipment, like from setup all the way to troubleshooting and maintaining the purple air sensors. How would you rate these? Easy, medium, or hard? And we saw a lot of green, easy responses, which was great. For the most part, I think the areas that were a little bit more difficult or medium for folks were the remote equipment setup process. So just finding a place where that hotspot would actually transmit, plugging in the purple airs, that process, we were communicating with participants on the phone and able to help in a way, but it was still a little bit more intensive. And then to just troubleshooting the purple air monitors if things went offline. We did have one respondent say the surveys were initially hard, but it was good to hear that they got easier and more routine as the study went on. So overall, great things to be thinking about in future iterations of this study. And a point to make too is just the methods that we have in place, especially with these purple airs, allow for some flexibility with participants. So if someone doesn't have Wi-Fi access at their home, we could rely on the SD cards, and we can just tailor it to the populations we're involved with. And then finally, summary and key takeaways. While many participants were aware of pollution caused by wildfire smoke, many were surprised to learn about other sources of pollution in their home and how easily air from outside could infiltrate. And then having access to personal air quality data can empower participants to make informed decisions about their health. I think that's helpful to think about in future studies too. And then finally, the biggest takeaway is just that household characteristics and individual risk factors should be integrated into future intervention studies. This study definitely showed that remote real-time air pollution studies are feasible on a larger scale. And then getting to just the best part, thank you so much to my APE mentor, Dr. Ethan Walker, for all the mentorship you've given me, the Montana Center for Population Health Research for funding this project, and then our amazing study personnel, Dave Jones, Catherine Conway, and Abby McIver, who's an undergraduate student, for all the help they did. I also have to give a shout out to Blakely Brown for being the reason I came to the University of Montana, Carrie Harris for helping with some interview questions, the Breathe team, and Patrick Dye for always letting me borrow his keys. Thank you all, friends and family that have given support. And that's all I have.
Great, Taylor. Thank you so much. Great job, everybody.